one. All right. Welcome to Planetary Health First, Mars Next. It is going to be an amazing journey today. Hope you are ready for liftoff. We are live now. Welcome to Planetary Health First, Mars Next. I am Michael Mann, the host. Love doing this. We have an amazing guest, Dr. Adam Carewe, today on our show. And not only is he a clinician, but he knows technology. And so this topic we're going to be discussing is kind of trying to think differently about healthcare delivery. And yes, we have AI in there. Yes, we have tech. But really, it's about driving better care decisions around the patient-centered decisions. So, Adam, could you just give us a little backdrop, who you are, where you've been, and where you want to go, and what you're doing?
Yeah, no, thanks, Michael. I appreciate being on the show. As you can probably tell, I'm getting over a little bit of a cold, but I have a voice, which is the positive part. But yeah, so I'm a family physician by training, and I'm also board certified in clinical informatics, which, I think a layman's term for that is it's a clinician who can bridge the gap between technology and the clinical care. So it's really like a liaison type of clinician, and it can be a physician, a nurse, a pharmacist, whoever. And that's what I've been doing for, I'd say, the bulk of my medical career. I'm about 12 years out from residency training, which I did here in Denver. And, I've worked for Kaiser Permanente in Colorado ever since. And so I function as their chief medical information or informatics officer. And yeah, just have a passion for making healthcare better for two primary customers. Number one, patients. I want patients to have a better experience. And then number two, I want to make it better for the physicians and other clinicians that are part of the care delivery team that is delivering this care. So that's a bit about me.
Cool. Well, thank you for that. And so what can we do to think differently? What are we doing wrong? Should we start with where we are right now, kind of with the paradigm, what's going on with healthcare before we dive into thinking differently? Where are you seeing where there's issues and problems?
Yeah, I mean, I think, I don't think anyone would be surprised with this comment that I'll make, but, I mean, healthcare is always like a laggard industry. It can't quite stay on the fringe cutting edge of like what everyone's used to in our consumer lives. So, where, the concept of like an Uber came along and, kind of blew everyone's mind and obviously shook up the taxi industry. And then Airbnb came along and kind of shook up the hotel or, resort kind of industry. I think healthcare can't always do things like that. I mean, I will say, I think there will be some disruptor in the future that will probably be that type of disruption that, those two examples I just gave. But I think with healthcare, there's so much other issue at stake where you have to be extra careful because you're dealing with people's lives and people's privacy around their health. And so where I think people get frustrated, like, why doesn't my healthcare just work like my iPhone or my Android? It just, there's a complexity to it that, historically has been there. And I think that's what leads to a lot of like generalized frustration, with the healthcare industry in general for consumers or patients.
So what could we do differently?
Yeah, I mean, I think there is a hyper focus right now in healthcare where, all the stuff that we've learned and excel in, in the hospitality industry. I think a lot of that is starting to transition, into, big healthcare systems, but also small clinics. I think consumerism is rampant in our society, and people want, a good experience. They want to get care when they need it, when it's convenient and accessible, and they want it like the way we get our Amazon packages, delivered in 2 days or less. And I think what's challenging is the historic paradigm of medicine was like you have a physician or other clinician who's seeing patients and they have a schedule and you have to fit into that schedule, and if that schedule's full, you have to book out. Like, I mean, can you imagine if restaurants were like that? Like you couldn't eat at a restaurant for 2-3 months because the restaurant was so popular. I mean, people would freak out.
Yeah. Or they'll say the doctor doesn't do their schedule 6 months out. That's
Correct.
another one that's
we don't have the template.
Yeah.
Yep.
So I think also call back tomorrow at 8. And if you're lucky at 8:15 that you get in that first day, same day. I saw someone post something that they were pediatric care at 8:02. They couldn't get to see in. So where do they go? Urgent care. So anyway.
Correct. Yeah. And I think that's the nature of the system is like, I think fundamentally all patients want, I mean, and I'm a patient too, obviously I'm a physician, but I have to get care at times as well. And I think all people really want is they have a concern and they want like that concern addressed, not necessarily resolved or, completely rectified, but, if it's a minor kind of acute thing, they just want the advice of what they should be doing. And I think that part of medicine is really challenging right now because you have to fit into one of those like scheduled buckets, of care. And there's asynchronous ways too, like different practices will have like either, questionnaires or e-visits or, even emails that you could like send. But those too, I mean, those are okay, especially when they're nice and structured, so that person gets the right info. But I think we need to kind of push the envelope to think differently in a lot of these ways.
So what, I guess with AI that I'm hearing, I'm really excited about technology, but I just don't see, it's like trying to put a nuclear energy engine in a car. I just feel like there's so many low things that we need to redesign, just simple, basic patient experience. Now, AI would be great for clinical trials or something really super focused, but that's some of the worry that I have. What are your thoughts on that?
Yeah, I think what you just like explained is something that I've been kind of sharing after I finally heard these words in this way, because I've been saying the same thing. Like, you don't want to just make something that's not really great, like faster. When technology comes along, you want technology to enable something new, like let's rethink things. And I think, the best analogy of it is an essay that I read by a venture capitalist who's a sharp dude who's actually in medical school right now. And he just said the problem with AI right now in healthcare is everyone is so focused on just making a faster horse instead of actually thinking about let's actually invent the car, and so to your point, there's so many inefficiencies across the spectrum of healthcare, from scheduling to gathering information for a visit to actually having the visit to documenting the visit to coding, blah, 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 all, patient instructions, kind of that full spectrum that AI can help all of those. And I think we should do that, but it's like we have to kind of like be thinking about like AI 2.0 as well. What's the reimagined way going to look for patients in the future?
Yeah, I had a great conversation with a clinician, a psychiatrist. He has his own substance abuse clinic, and he was talking to me about his needs. And he was like, well, I got a PA. She just won't document. And, it's just like, it's like, AI is going to be great, but if you don't have an encounter, how do you get paid? So it's just like certain things like that. So anyway.
No, and I think like, where AI is having its real initial heyday in healthcare is the group of companies that are creating like an ambient listening AI, that can literally just be a phone sitting between a patient and a clinician, or, even connected to a telephone call or a video visit. And it's recording the whole experience. And, the back end of it is teasing out the stuff that's not clinical, so if you and I were having a patient visit and we were talking about your last vacation or whatever, the systems can actually tease out the non-medical stuff. That's kind of the secret part of their kind of algorithms. But then it outputs, in somewhere between 30 seconds and a minute, this like amazing clinical note, that I would have typically written. And then the secondary benefit of these is it not only parses, it puts that note in, which, like you said, is needed for the billing and all the, documentation portions of the visit, but it also can parse out the pieces that are specific to the patient, so like the concept of patient instructions. Like, I mean, how many times after a visit does a patient go home and go, I have no idea what the doctor just told me to do.
Mhm.
Like I know I have to get this lab, but this type of technology will be able to give that kind of shopping list for a patient as a reference. And it's frankly, it's better than any instruction we could do as a clinician because it's coming directly from what we said during that encounter.
I love that because right now you get the printout from whatever that long medical, the long
Yeah.
health literacy company that's a printout of just generic, just to the whole population. And now you're getting such a specific. I mean, that to me is huge. Talking about patient engagement,
Yep. Yeah. I interviewed one of the CEOs for one of these companies recently on my podcast. And, I think something that they are doing, there's a company called Abridge, like A and then Bridge, one word. And, a piece that they're doing that I think is very cool is in this concept of on the patient side, the patient instructions, where not only does it generate this list, but if that patient goes back to that later and goes, oh, there's this thing that says I need to start taking this medication this way. And, it's a little, bulleted line. But if the patient hovers over that line, it will play back the audio file of the clinician saying those instructions in that visit. So it's kind of like this secondary reminder. That's just, I mean, I think that's the kind of, that's not making the faster horse. That's actually making patient instructions better, fundamentally.
And then not only that, the clinicians, like gosh, I feel like I'm just using all my anecdotes or my lived experiences, but I was at the pharmacy the other day taking a new medication, and I asked the pharmacist, consult with the pharmacist, and like they're so busy, I don't want to mention which one, they're all busy, whether it's Rite Aid, CVS.
Yeah.
And she's like, I have no idea. I'm like, and then she's like, gets out that whole papered map that looks like a map and reads it. And that, talking about better clinicians, better providers, if they had access to that in real time, that to me, do you know anything about that or user cases that are empowering the clinicians or providers?
Yeah. I mean, I think what you're getting at is like, because right now, I mean, ever since ChatGPT went live, literally just about a year ago to the public, I think everyone has probably touched upon that in some way, shape, or form, whether they made a song with their kids or helped, formulate an email that you want to send. But I think where these technologies are going next is, like technologies like ChatGPT are just trained on the internet's content, which can have good content and can have, inaccurate content. I think the next wave of these are going to be models that are trained on that specific knowledge, so like your case of the pharmacist, like a pharmacist has that knowledge base somewhere, like it's either on a piece of paper in some sort of database or whatever. Like if we can just have a model that sources their answers from that, I mean, theoretically that could be on your phone and it could be an app where you could say, oh, I'm starting this new medication for this reason. What are the biggest things I need to worry about? Like a patient could just ask that free text, and then it would comb through and be like, okay, the major risk factors are this, and these are the side effects that you may expect to have. If you have any of these, you should contact your physician. Like that's a simple product that I think honestly all of those types of things will exist in pretty short order.
So we're coming to 2024. What is going to happen in 2024 that you see? JP Morgan's coming up. I mean, of course, that's a venture capital, healthcare, biotech, science. But if you could like put out a prediction, what are you excited about in the next year for healthcare?
I mean, so I'll answer that in two ways. Like I mentioned, like the two customers that I typically serve, both the physicians and care teams and then the patients. I think the thing I'm most excited about for physicians, because a lot of this AI technology is going to come to their lap first, and then it'll kind of transcend and it will roll out to everybody else. But I'm very, very happy for the first time in my career, where I can fundamentally say, once you get your hands on this kind of ambient technology, like it's going to change your life as a clinician. You won't be writing notes in bed at night, which we call pajama time. You won't have to take stuff home with you necessarily. I mean, there may be some work you have to do here and there, like any job, but that concept of the grind of 20 plus visits a day and not having time to write anything down, or you write down the bare minimum, That I think is going to go away. So that's going to be a huge lift for, what I would call the joy of medicine. We all went into medicine wanting to help other people and have a conversation with them, figure out physicians are really just glorified engineers. Like, we're just trying to figure out what your problem is and figure out what the diagnosis is and the best way to get you better. And if we can just focus on that and not have to deal with like the extra fluff of like documentation burden, that's going to be huge. And then I think because of that, patients are going to love this. I mean, what patient wouldn't? I mean, I'll ask you, like going in to see a doctor, where you're looking at their back as they're typing, as they're talking to you. That's an efficient doctor right now. You have to document while you're visiting with someone. I mean, I just, it's amazing to think you could walk into a room and just sit across from someone and go, hey, do you mind if I turn on this little microphone on my phone and we just have a conversation about what we're going to do? It's going to lead to better care.
You're actually looking like you and I are having a conversation, whereas they're not,
Correct. Yeah. And I think the secondary benefit for a patient is, many things we document, we don't actually verbalize to the patient. Like when I'm like examining someone, I'm not going, oh, I hear little crackles at the base of their left lung, which can be an indication of a pneumonia or something else. Or like, I hear a murmur. Like, I don't verbalize that to someone. Well, with this technology, if you want your whole note to come in, you actually have to say everything that you're hearing, feeling, seeing, and thinking, because that's how it gets captured. And so I've heard already from patients that have used this technology with their doctor is they love it because they're like, oh my God, the doctor's telling me so much more about what's going on.
And that's after it's printed out and captured, I imagine, and it's shared with the patient, correct?
Yeah, most states have regulations that require open notes now, so you have to have access. But yeah, it's like, but now you're hearing it, firsthand too, which normally you wouldn't hear those things as a patient in the room because the doctor would just be over there typing away. And then, you might get it in your note later. But I think that it adds to a richness of a conversation, when you can hear those pieces.
Now, is this the technology you're talking about? My concern with technology right now with innovation is that it's controlled by the big five or big seven or however you call it. Now, are we going to see a lot of potential for innovation with smaller startups with these, or is it going to be just one monolithic company that possesses this amazing dragonfly, whatever AI? Where's that going to play? What's your thoughts on that?
Yeah, no, it's a good question. And a lot of people have been asking me this because I've interviewed, about 6 or 7 of these companies that have a product specifically in this ambient space as a start. But, and my reason for wanting to interview them was to actually learn more about their product and the people behind it. And what's very interesting is I think, these companies are going about it from a variety of ways. So like to your question specifically, yes, there's the behemoth company Nuance, which makes the product Dragon, which was like the dictation product that everyone used. They're owned by Microsoft now. So, they're obviously a behemoth. They're going to be popular and they're going to be successful. But they're going after the big enterprise kind of healthcare client. Now, there's on the far end, on the opposite end, there's other companies, there's one called Freed, getfreed.ai, I think is their website. And it's literally like as a single clinician, you can sign up for it. And it's like $100 a month and you get unlimited ambient notes. It's not integrated, but it's an app on your phone and you have a website and you can just do the copy paste. So I really think that full spectrum, there's pieces all in between. There's going to be a place for I think for all of these players in some way, shape or form. And a lot of them are doing it in slightly different ways too. But it's, I'd say it's a huge market that is ripe for innovation.
So after I drop this and post it, it would be great if you could share with me those names offline so I could get all those. I think that would be really helpful to our audience. That would be
sure.
Awesome.
No, happy to.
And I also imagine for doctors, when you're saying the smaller doctors, really, as much the revenue cycle trying to get billed and paid. Now, I could see, can you share maybe how that would fill in, getting that encounter and maybe how that goes to those billers and the coders? I'm kind of interested in that. That would be cool.
Yeah, no, happy to talk about that. And yeah, and I think like just in the lens of like the independent or small practice clinician that could be using this, I mean, the biggest benefit to this is this should be a way for them to be able to see more people, more patients per day. So like just from like a specific kind of return on investment of the cost of it, it's going to be recaptured really quickly. But I think where these technologies are, some of them are going already, is not only are they just kind of developing the note for you, but some of them are starting to discreetly kind of capture, elements of that note that lead to coding and billing. So, coding and billing is driven by specific diagnoses of the visit, and you want the most accurate and specific diagnosis. Like if I saw you for a respiratory illness, I wouldn't necessarily want to just kind of document that as like, oh, they have a cough, they have runny nose, they have a fever. I mean, those are diagnosis codes. I would want to diagnose the actual like specific illness that I think it is. Like this is an upper respiratory illness, or this is a sinusitis or a pneumonia. And so I think these tools are going to start helping clinicians make a better, more informed diagnosis, which frankly could lead to better reimbursement from a fee-for-service model, but it's also just going to lead to better quality. Like you're going to just put a more accurate diagnosis and kind of level of service, that really fits what you did.
So you're seeing possibly like some other technology companies like integrating with that encounter, kind of helping that clinician like yourself look at that. That might make sense if these three match up. This is really where we're driving the diagnostic decision making.
Correct. Yeah, you're getting into what we call clinical decision support, or CDS, and that's just the notion of something in a system that provides that clinician like a nudge to do kind of the right thing, from a quality and a accuracy perspective. And this technology, I think, is going to vastly improve that.
So what's going on right now in today's world?
Yeah, I'd say current state. So if you go the biggest enterprise wide, right now, all the biggest EHR vendors that create the software that everyone uses. I mean, it's, Epic, based out of Verona, Wisconsin, is definitely the biggest. But then there's, Oracle Cerner and, Athena Health and several others that, are just smaller market share, but kind of cascade down. All of them are working right now and having partnerships with frankly one or more of these vendors.
Okay.
Because they've realized we can't do this technology on our own. Like we need to figure out a way to actually integrate. So like in the case of Epic, which is the largest EHR vendor in the United States and it's growing in the world, they have already announced officially that both Nuance and Abridge are specifically working with them. So you can license that from the vendor and it'll be fully kind of baked in to the EHR, which is key because all these tools, although they're great, if they're not a part of like the workflow that a clinician is doing, it makes it harder to use them, and so having it baked in there is really key.
So if I understand you correctly, this is not like no longer doctor just talking into it and it's typing out. It's literally, it's there like the ambient, like surround system, and it's capturing everything in real time. And you're no longer, other than just reviewing it afterwards.
Correct.
Okay.
That is what this is true, like hands off the keyboard. I mean, and like still you're going to have to like place orders, if you want to order labs or medicines. But I'd say this technology is not in short order. Some of these companies will also be able to start queuing those up. So if I mention I'm like, oh, okay, I want you to take this new medication for your blood pressure and I want you to get these labs. If I just verbalize that, when I go back to the EHR, either at the end of the visit or when I go sit back at my office desk, those will be kind of queued up. I still have to sign them, because that's ultimately me. But yeah, that's that kind of decision support kind of queuing up for you. So yeah, that's the way it's going to work.
So we're talking about this is probably next to the EMR, which really we can agree that the EMR did not promise what it promised to free up doctors. It actually did the work, just the opposite. So this might actually be the promise 2.0 of the EMR's original freeing, like truly
Yes.
freeing up the doctor.
Yeah. I mean, I always say the only thing the EMRs did that was net positive was it made it so we could read everybody's notes without trying to figure out what it said. that is that is honestly, and then obviously the data aspect to everything that's in an EHR is amazing. The problem is when we made all these, we didn't make all that data um, fully exchangeable.
Mhm.
I always give the analogy of like a plug in your house. You buy a product off the internet or wherever, you can charge it, and yeah, if you
Mhm.
go to a different country, you got to buy an adapter. The way information is exchanged in EHRs, it is like a mess. You have
Yeah.
to do all the custom mapping just to get this system to speak to this system. So that's another area. I'm hoping AI will be able to take all of that mismatched information and apply some intelligence to it so your information from one health system can seamlessly flow across. I think there's going to be a company that comes out that really solves that problem too.
So using AI to really seamlessly create interoperability. Like,
Correct.
okay, cool. Wow, that's
Yep.
another one. All right. Well, we're kind of coming towards the half point. I don't want to go down, I tend to talk too much. My wife always says, stop talking so much. You're just going on. I stumble, I stamper anyway. But I'm still trying to do this yet. But where do we want to go these next few minutes while we're here?
Yeah, I mean, let's delve into a little bit more into like not I mean, we talked about kind of the current state and maybe the near future, but like I think let's talk a little bit about where we think the future, like that 3 to 5 to 10 year kind of outlook goes.
Okay.
Because I think patients and consumers would be interested in that as well.
Okay. I don't want to leave my house anymore to get taken care of. Why are we doing this still? I mean, I just
Yeah.
80%, like all the stuff that we're doing for encounters, like just tell me if I have a cold, tell me if I have a virus. Now, I haven't gotten into a gunshot fight yet, but other
Yeah.
than that, I don't want to go to the hospital. When will hospitals say, you know what, we understand, we are patient
Yeah.
centric, and we know you don't want to be here?
So this is the thing. I think so all of that experience that you're just discussing, that's driven by the way insurance dictates how things are reimbursed. So, if we remove the COVID pandemic when they did relax some of these restrictions, where they did allow clinicians to start billing for telephone encounters. I mean, because believe it or not, you can't actually bill for a telephone encounter. Like the reason why your doctor makes you come in to talk about your lab results is because they don't get any reimbursement for that, evaluation and
Mhm.
assessment of that. And frankly, I think that's wrong. I mean,
Mhm.
like, you wouldn't talk to a lawyer and then have a follow-up call with the lawyer and just be like, oh, that one's free, right? Like that one's included. I mean, that's really what happens in
Yeah.
medicine. So to your question, like, why can't we just do everything virtual? I'll say in the future, I think there will be a diminishing demand for hospitals and physical brick and mortar medicine. It truly will. I think, but it's going to take an overhaul of the whole system,
Mhm.
from the insurance to pharmaceuticals to the way healthcare is delivered.
Mhm.
But there's no reason why we can't get to that way. I mean, we've done
Mhm.
it in every other facet of our life.
The thing that bothers me the most, and I don't want to sound like well, I guess I am a radical. We're planetary health first, Mars next, but the whole insurance, it's a racket, right? I mean, who in their life would be able to? I mean, it's talking about taxation without representation. I understand they have to have a risk pool, and the people that don't ever get sick or just give them the spread of the money to do the, whatever on the
Yeah.
actuary data. But when you think about it, can I just give you 5 grand or 7 grand for like catastrophic events and then pay everything out of pocket? I feel like if there was across the board, all 50 states, and I'm not, I got my MHA, but I'm not a big, I don't, I'm not a healthcare economist and all this. So,
Yeah.
but I'm just speaking as a consumer, you know, why there's a problem there with our payment that
Mhm.
really I think is leading to, anyway, I'll stop there. I'm talking too much, but anyway.
No. This is a great conversation. I love having these conversations with people that aren't in the healthcare industry because I think several things you just said are 100% right. And I'll just say, I think, you look at the US, we have by far 3 times the cost that we spend on healthcare compared to other, kind of countries of similar size and stature and, and wealth. But our outcomes are extremely worse. And so, I mean, think of a business. If a business costs too much to run and they make a really crappy product, I mean, is that a business that's going to be viable like going forward? I would say no. And that is the way, I would say fee for service healthcare in America works. And I'm specific by saying fee for service because that's the model that's the majority of healthcare. I'm fortunate the organization I work for is not fee for service. It is an integrated system that has an insurance product, a medical group, care delivery system, and everything is integrated. There's a pharmacy, there's a lab, there's clinics, there's hospitals in some of the regions, so it's kind of like, I call it like the monopoly of healthcare. You have all those pieces and parts that go into the whole economy. And is it perfect? No, it's definitely not perfect. But I think that's I think there's a problem in America. I mean, it is. And, right now, again, I mean, if you read any type of economy news around healthcare, hospital systems from large all the way down to small rural systems are struggling. I mean, their margins are either thin or negative. But guess who's making huge profits still on all of this? It's insurance and pharmaceuticals, which again, we need medicines. We obviously need some sort of insurance, to your point, but there's definitely an imbalance that I don't think is quite right.
And I guess we can't figure that out today. But you did pose the question 3 to 5 years. Let's get back to that on some stuff that probably is more on the tech, more on what you're thinking. Tell me what you're thinking, healthcare, what it would look like, what it could be, reimagined healthcare in 3 to 5 years, Adam. What do you see?
Yeah. So I think something that's really worth mentioning to your listeners, is, healthcare right now, I would say is not very personal in the sense of, the recommendations that we give, for either screening or prevention or for treatments is not really personal. It's based on evidence, but it's based on evidence in populations of people. What I think is going to change, and there's already some of this already happening, but there's going to be a level of precision and personalization that's going to come to medicine. And what I mean by that is, it'll be tailored screenings for you based on your risk and your profile. So that could be your genetics, which I know gets a little scary. People, there's obviously that huge leak with 23andMe leaking 6.9 million of their files. But, if we can protect that patient information, those genetic markers and traits that people have and the different factors that lead to bad health, we'll be able to prevent a whole host more things. I mean, really the goal of healthcare is actually to prevent you from getting disease. But we are, so much of healthcare is like reactionary. It's like, you haven't ate well, we haven't treated you well, now you have diabetes and high blood pressure and heart disease, and now we have to spend all this money to fix your arteries. It's like, if we know that person's predisposed to all of that, we should have these intervention steps early on. And I think that's what precision medicine, so that's the concept that I think is really going to take shape over the next, I'd say 3 to 5 years, because right now it's only available for really the super wealthy that can pay the $20,000 retainer, to some sort of genomics practice. But I think that technology is going to get better with AI, and just in general over time, everything gets cheaper with time, and it'll unlock and allow people to have that personalized, individualized, healthcare, which I think that's what people want. They don't want to be like, well, I know you always treat someone with this condition with this medicine. What's the best medicine for me? I can't answer that. All I can say is this medicine we know is the best for the population. But once we know your genetics, we could say, oh, no, actually for you, let's go to this medicine first, because this is the one that's going to work best for you. And that's going to be cool. I think people will love that. You won't be treated like a number. You'll be treated like an individual person.
Yeah, I think that's awesome. The little I know, what you're referring to is like there's a $400 lab test that can show how you metabolize, but it's really certain
Correct.
medications, but it's not necessarily, the insurance won't necessarily pay for it. But it is unfortunate because from what I've heard from some pharmacists is that, a lot of these medications are very costly. So in the end, you could, and then also with the diseases, if so that's the other thing that's really challenging is it's so siloed. You can't really connect those longitudinal things. Well, geez, this person got this, and now they're totally this cohort has not been hospitalized. Their outcomes, we just don't have that. But
Correct.
with what you're doing, that could be we could get there. The only worry I have is that we're gonna the risk that I see is that there's so much of a two-tier health system. I think this concierge, it's just, and I even feel it at this point. I'm getting more and
Yep.
more frustrated with my academic doc. I mean, it's not his fault, but still,
Mhm.
the labs are separated, the EMRs, and it's just like, but I don't know. I guess at this point, the jury's out. But it just seems like what you were saying earlier, which I think is interesting, like in Japan, the doctors get paid when you're well. I think that would be,
Correct.
yeah.
Yeah, you're getting at like that incentive piece, because like right now the model is clearly in like the fee for service or fee for volume healthcare world. The more you see, the more you do, the more procedures you do, the more you get reimbursed. So that's the incentive, which that doesn't sound good, like from just a healthcare, kind of a patient care perspective. But yeah, I mean, if you can flip that, and even the organization where I work, we have like value-based payments, like that.
Mhm.
We have metrics that if we meet as a whole group of physicians and we get our whole patient population to certain targets that are, good health markers, then we are financially compensated for that, and it's extra. So it's kind of, I mean, that is what drives us. Like we see
Mhm.
in the beginning of the year, these graphs look awful, like our diabetic patients don't have like the best control because we got a bunch of new people in January. But
Mhm.
then over the year, we start chipping away through all the different care teams and care coordinators and system things. And all of a sudden this graph is like getting closer and closer and closer to the benchmark that we're going for.
Mhm.
And I mean, that's value-based care payments, which is also something I think that will come much
Mhm.
more in the future,
Mhm.
as more systems adjust to
Yeah.
that.
So what are you with technology this year 2024? What would be the one thing that you would hope to see that could help this value-based acceleration? You think that could really help it? Is there anything in technology, or is it more
No,
policy?
I
Or
think there is. I mean, a lot of it is policy. Like to that last comment, a lot of it is going to be which insurance company will be able to, what insurance companies will compensate for these, because like right now the majority of value-based care payments are coming from, specifically Medicare. That's Medicare Advantage is a big plan that it kind of puts a little bit of onus on the clinicians taking care of those patients to really handle all their chronic illnesses. I think where technology helps with this, and again, we do this internally in our platform, at Kaiser as well. But you know, we get paid, for, in the case of Medicare, we'll get paid for kind of the conditions that we're managing, not the number of times we see these Medicare patients. So it behooves us when we see them, let's handle and like get all their stuff kind of shored up. So we get the reimbursement for it. But then we have all the systems and the processes and the technology that can help kind of manage these conditions over time. Because like someone that's well controlled diabetic, they don't need to come in every 2
Mhm.
months. Like they
Mhm.
need to come in maybe every year and then get labs every 6 months. So we can have technology that can be the checker.
Mhm.
And I think that's where like these AI type of tools, even, the concept of like a patient having like a little co-pilot with them, like a
Mhm.
little, their doctor co-pilot. And man, how quickly this synthetic voice and video is coming along in AI. Like what if you could have like a little virtual avatar of your doctor, as an app, and that person would be reminding you of things over time? I mean, that's going to be pretty cool. And I don't know if that's going to happen in the next year, but I think those types of things are going to start to evolve over the coming years, because they're going to be too hard to ignore.
Yeah, I also see like things like peer support groups that could be connected through apps. I mean, there's just different ways to pull people together and share decision making.
Correct.
I would love for you. You're out of Denver. Tell us a little more. You have a blog. You're doing. Tell us when it started. What motivated you to do it? I think this is awesome. Hearing doctors getting involved in other things. You have sort of an entrepreneur interest. Tell our viewers a little more about yourself.
Sure.
That'd be great.
Yeah, I mean, so it'd be no surprise to anyone that's listened to this so far, like how much I just have enjoyed technology throughout my life. So several years ago, a couple of my friends were over for like a dinner party, and they were like, you know what, we always ask you for advice, like on what's the best like robot vacuum to have, or what's the best automatic litter robot that will empty my cat litter. And I was like, that's true, I do get pinged about that. They're like, you should start a blog on that. And so I did. Back in the day, it was like just super hobby, where I'd just be like, you know what, I'm just going to put out there like almost like the wire cutter mentality. Like, this is the one thing that I really like. And if you like it, you can get it. If you don't, then move on. And so that was like a initial blog that I called techdadcolorado.com, like techdadco.com. And then when my buddy and I, Dale, who's a fellow physician informaticist like myself, we kind of had this concept of, we're these physicians and we're kind of nerdy and we like helping people and making healthcare better. And so we came up with the brand NerdMDs. And we had, I like logos and graphic art. So, we created this brand before we actually knew what to do with it. So we kind of blogged about healthcare in the context of nerdmds.com. And then, I think as time went on, we were just like, well, we should just do a podcast too. Like because then we can interview people in healthcare or adjacent kind of industries and just help people with being more efficient in life. So we were like, okay, let's kick off this podcast. And so we just started that, and we titled it Efficiency Unlocked, Nerd Tested, MD Approved. And it's obviously a little kitschy title, but the efficiency unlocked part is really kind of the way we function. Like, even outside of our physician lives, we just love technology. And so we use it to help us do things easier and more efficient. So we're like, why don't we just start having cool people on the show that can kind of share these things? So we've started that. And, I think I aggregated all these together recently in a Substack, because I was like, wow, I can pull all this together and just host the shows. I can do the blogging. I can kind of aggregate everything. And, and so that's it. It's a total, like, I wouldn't even call it a side gig because it doesn't really make any money, but it's more of a side passion. And I love doing it, and I love sharing with others and learning and meeting new people. And so it's been a great vehicle for that.
That's awesome. I love the names. I love the titles, and I love the purpose. And I'm sure there's so many, even more than clinicians, getting value out of that. Probably anyone that is in healthcare, cross healthcare or non-healthcare as well. It seems like you've made it really accessible for pretty much all.
Yeah, I mean, I like to kind of like be diverse enough. And one of my buddies, I played basketball in college back in the day at Humboldt State University in Northern California, and my last name Carewe is, everyone had trouble pronouncing it, so he just started calling me Ruski, and so that was like, I just became Ruski on my basketball team, and I was like, oh, that's kind of a cool nickname. I never had a nickname growing up. I mean, some people would call me AC, or some sort of derivation of my abbreviated initials, but so that's actually what Ruski.com is actually like the parent that kind of brings together all those different kind of blogs that I had, because it's an easy URL to remember, and it's specific to me. So yeah, if you go to Ruski.com, that will kind of funnel you into all of the stuff I just talked about. But yeah, you can pick and choose if you want just the tech, if you want the health stuff, if you want the podcast, you can kind of listen and choose what you want to follow.
Do you advise any venture capital groups, any startups too? I mean, I would imagine you're sought after just with your background.
Yeah, I mean, I'll tell you, I like love that space, because like again, the reason why I got into informatics is because I could be more effective, to my system that I was working in than just I could be with my individual, 20, 25 patients that I would see during the day. And I think going up the chain, like you just mentioned, helping to advise either venture capital or something else. I mean, that's another way that I can use my knowledge and, my help to kind of scale other ideas better. So no, I'm not doing any of that now, but I'm definitely interested.
Okay. So if someone that's listening that might be a startup founder or getting ready to, or a venture PE group, they can reach out to you for a conversation on that.
Oh yeah, no, I'm always happy to have
Cool,
conversations with
cool.
folks. Absolutely.
Now, you are in what I think is one of the best places in the world close to, I mean, there are some really cool places, but Denver, you got a lot of accessibility for activities, outdoors,
Yeah, for
super cool
sure.
place. There's nothing like Denver. What do you think makes Denver special?
Man, I tell you, like, so I had not been to Denver before I moved here with my wife. Well, we had come here for a little bit of a rotation during medical school, but no, I agree. Denver is very cool place. I always say the only negative of Denver is there's not a beach nearby. Like that's the only thing I can say bad, because I think people think of it as like, oh, it's this like wizard, this blizzardy kind of winter. Denver has more sunny days than San Diego, California.
Wow.
So Denver is like the most sunny place. If you don't have sunglasses, I have like 20 pairs of sunglasses everywhere, because you walk outside and you're like, got to put the glasses on. And yeah, and it's just, Denver's a cool town. Obviously the downtown area is very hip and cool, but like you're 1.5 to 2 hours away from like the coolest outdoor stuff that you can have pretty much anywhere in the country. And so we spend a ton of time up in the Rockies with our kids, and skiing and mountain biking, hiking, boating, whatever we can do. It's a great place to live.
It seems like it's a great nexus. There's a lot of space tech. There's a lot of startups. There's just a great nexus for talent. So it.
Agree. Yeah, there's a ton of like very cool, even health tech startups that have started here and have grown. And but yeah, to your point, there's a lot of industry here too that, it's and geographically it's very centralized. I mean, it's if you live here, you can get anywhere pretty quickly around the US, and then even, Central America, South America. I mean, it's closer just because of the geography.
Well, Adam, I'm so glad you said yes. I know we were having trouble getting our schedules together, but really glad you stopped by here on the planet Earth first and not Mars.
No, this was super fun conversation, and I love what you're doing, and the title of your podcast is even better, because I do think at some point we will be at Mars. I don't know if it'll be in our lifetime, but maybe it will.
I think so. That one guy, I think we both know his name, Elon, slightly controversial, but I loved reading his book. If anyone's into innovation, and I say this agnostic, apolitical, it is one of the best books on innovation that I've read, and I think also attributed to one of the best, Walter Isaacson, with the way
author.
he researched it. But as we're coming towards the end, another question I would like, just sort of, do you get to conferences? What do you, I hear with your blog, you've created sort of a community, but what are you doing to feed into your innovation? Do you go to conferences? What do you do to kind of get out? I know you have a great community with Kaiser, but tell me a little bit if there's anything on your schedule for 2024.
Yeah, I mean, I think so. Like, yeah, big health wise, we use Epic, that EMR I spoke to before early on. So Epic has, two big kind of what they call like their user group or their expert group meetings per year. Those are actually really fun to go to, because it's all customers. So you get to be around other like people, and they talk about stuff. So those are like fun. That's like very insular though. There's also huge health tech conferences. I mean, there's the biggest one, which is HIMSS, which can only be held in, I think, 2 or 3 locations in the entire US because they're so large now. And I've gone to that. It's honestly, it's so big. It's like almost overwhelming. But, then there's other smaller ones like Health, which doesn't have any vowels in it. So you have to like spell it weird. And Vive is another one that's, kind of health tech focused, which are cool. But honestly, this year, my buddy Dale and I, we're actually going to go to CES this year in January. They have a whole digital health kind of focused, kind of subgroup of that conference. And it wouldn't be a surprise, I think, to anyone. I'm interested in just the consumer tech that's there too. So we'll get to dabble in the showroom for that, but also get to, meet other people and do things. So we'll be in Vegas for that week, which should be a fun time.
Do you ever see yourself doing your podcast live at an event like that?
Yeah, it's funny. I just recently got, a microphone that, by the company Zoom, that the microphone itself could actually like record on it. It has a little stereo kind of mic on it, and it just runs on 2 AA's, and I'm like, I think I'm going to bring this with me. Like, even if it's not a live show, I can at least like kind of ask people kind of questions, and then it'll make it super easy. I just dropped my phone on my glass. Sorry about that. But I think I'll be able to interview people and get kind of cool sound bites, around. So it'll be, I'll most like, but yeah, I think all of that sounds pretty exciting and fun.
This is great. Well, we would like to do more interviews. I think 2024, I would like to do like bring a friend, where you bring your friend, I'll bring a friend, and we'll do another thing if you'd like.
That sounds awesome.
And I think that creates much more of a robust, safe dialogue, discussion, where really rich conversations come about. So that's what I'm sort of looking at, and I would hope that we could get you back on, and hopefully sometime I'll be able to meet you in person as well.
Yeah, I love that. I know it's the coolest thing about these is it's great to meet people, but it's nice to finally meet them in person someday. So yeah, that'd be great.
Well, this is awesome. So we are going to call it a day on Planetary Health First, Mars Next. Friends, it has been a great journey today on Planetary Health First, Mars Next. Follow us for more on Planetary Health First, Mars Next. Until next time, peace be with you.